Welcome! Toward an approach of the contagion curve for COVID-19 in Mexico. María Beatriz Bernabé Loranca, Rogelio González Velázquez, Erika Granillo Martínez, Jorge A. Ruiz Banoye, Alberto Carrillo Canal. Benemérita Universidad Autónoma de Puebla, México. Toward an approach of the contagion curve for COVID-19 in Mexico. Outline, abstract, the problem, contribution, results, conclusions. Abstract. This paper explains an exploration of data from the WHO and the ECDC to foretell the behavior of infection by COVID-19. Different approaches were made to conclude that the logistic function and the rate disease caused by the SARS-CoV coronavirus regression equation generates forecasts with a good approximation. On the other hand, a multi-criterion model is used and results are compared. The race augmentation rate was estimated on May 5th and held for 10 critical days thereafter. The problem. Since the emergence of a virus that has spread worldwide, the now known SARS-CoV-2 coronavirus emerged in China in December 2019 and causes a disease called COVID-19. Translated by the contagion capacity and exploration, it spreads like a pandemic and has involved a number of health measures around the world. On the other hand, many energies have been applied to find alternatives for humanity to be protected, where epidemiologists, virologists, and scientists in the area of medicines, biology, mathematics, computing, etc., are working trying not only one treatment for COVID-19, they are also striving to develop a possible vaccine. In addition, scientists in the area of mathematics propose models to forecast the growth of infection, determine the condition at the highest point, and subsequently set the decrease, which in this word is described as the flattening behavior of the curve. Contribution. Logistic function growth curve for Mexico. Technically, since it's buffer growth function that can shape the process of contagion of the virus that produced COVID-19 disease, is the well-known logistic function LF. The behavior at the LF at the beginning is exponential, and then it reaches its highest level when half of the population has been infected, to being a natural decrease precisely because the population is finished and could not continue to grow. This function reaches its threshold when the entire population has been infected. Logistic function. The objective is to find a point where the number of infections stabilizes, that is, it decreases in the mathematical sense. This stabilization is achieved when the contagion factor tends to 1. For this, we have the logistic equation given by Ln plus 1, that is equal Ln multiply Ep plus 1, where Ln plus 1 is the number of infection of the current day and which is equal to the number of infection of the previous day, Ln, multiplied by the contagion factor F, determined by the expression F equal Ep plus 1, where E is the public exposure of the population and P is the probability of contagion. This probability depends on the hygiene measure of the population, so the challenge is to make the terms EP tends to 0. If EP tends to 0, it is reached that F equals 1, and in this way the stabilization of number of infection is achieved. This is achieved by decreasing both E and P. This is by lowering public exposure, staying home, and implementing a strict measure to sanitize both people and free space. Applying the contagion factor equation and using the ECDC WHO data, it obtained the following results. It is observed that according to the equation ln plus 1 equal ln EP plus 1, there were 1,581 infections on May 7 and a gradual decrease. Simple linear regression. Applying a linear regression equation to the ECDC data, we have the following estimate. Prediction of the spread of coronavirus COVID-19 through multi-criteria analysis in Mexico. The objective of the multi-criteria analysis proposal is to predict the evolution of the COVID-19, so a multi-criteria system is used to quantify the population susceptible to infection, recover, or disease, etc. in a specific population so that the number of infected increases due to the contact between susceptible and infected and their geographical mobility, and decreased as the number of recovered increases. A starting point to study the spread of epidemics was the so-called SEER model, initial of susceptible, infected, and recovered, formulated in 1927 by the military doctor Anderson Gray McKendrick and the chemist William Algley Kermack. This model studies a population in which an epidemic can develop divided into three groups. First, susceptible, second, infected, and third, recovered. It is observed in figure that the recovery begins with May 13th, with a maximum between April 26 to 28, 2020. By May 7, the number of infected will reach 70,317 and it will fade in 14 months. Conclusions. Recovery will be May 13 with a maximum between April 26 to 28, 2020. By May 10, the number of infected will reach 18,855 and 1,483 deaths will fade in the next 40 months. We don't have antibodies against COVID-19, but we have them against everything that puzzles us. It is a paradox for our times. As a reality becomes increasingly complex, we become increasingly refractory to the complexity of research and innovation. Government and health officials must work together to prevent the spread of infection. Hospitals are deficient in their physical and human infrastructure, and they must enforce mandatory quarantines for all suspects. To those who do not show respect to the lockdown of schools, public area, industries, and commerce, it is advisable to impose fines and to implement periodic controls in order to contribute to social distance and to prevent the rising numbers of deaths.